This neurofunctional anatomy is too hard. I'll never know all this information before the big exam.
How do you feel, son?
Where am I? Who are you?
Hi, I'm Dr. Pudeman. You're in the hospital with a serious brain injury.
Wait, I'm in physical therapy school. I'm learning about the brain right now.
Oh, perfect. I guess I can explain that in the way that is beneficial to PT students. Let's look at your file. Well, it appears, Mr. Johnson, that you suffered a hemorrhagic stroke to your cerebellum after sustaining a traumatic brain injury to that area during a car accident.
Is it serious?
Yes, it is serious. Let me first give you an idea on where the cerebellum is located. Well, here I brought over some models to illustrate where the cerebellum is. As you can see here, it is located in the most posterior inferior or caudal portion of the brain. And then you can see on this other model, it's located between the cerebrum and the brainstem. So right, this gray structure right here. Along with the pons, it makes up the metencephalon of our hindbrain.
Oh, okay. Thank you for the helpful information. This structure looks like it's very helpful in identifying other structures throughout the external brain.
Precisely. Now, in terms of function, the general function of the cerebellum is coordination of our movement. More specifically, it receives sensory input from our eyes, ears, joints, and muscles about the position of the body in space. It then integrates and sends motor impulses via the brainstem to skeletal muscles to maintain balance. It also fine-tunes skeletal muscle contractions to produce smooth, coordinated movements. It detects differences between intended movements and the actual movements, and then uses motor neurons to clean up those differences.
So the cerebellum is basically the coordination center of the brain?
Correct. So, while collaborating with your other doctors, we speculated that your high blood pressure, in conjunction with the traumatic brain injury that you sustained during the car accident, caused a CVA, more specifically, a hemorrhagic stroke to the right cerebellar artery. You can see it a little bit better on this model, which caused the blood to bleed into the anterior lobe of your cerebellum. Do you happen to feel all right? Are you experiencing any strange differences in your coordinated movements?
Well, when I get up to walk, I feel dizzy, I feel like I have no balance, and I cannot walk in a straight line, and I also have trouble reaching for things.
It appears that you are experiencing ataxia, which would make sense considering the injury that you sustained. I will communicate this with your physical therapist to determine the best plan of care.
Gee, thanks, Doc.
Don't mention it, Mr. Johnson. Doctor? Doctor? The patient is stable, but he is experiencing some complications from the CVA.
Can you describe what symptoms the patient was feeling?
Let me look at the file.
Well,
He appears to be experiencing mainly loss of coordinated motor function and balance, primarily when he walks, as well as dizziness, and not having fine controlled movements such as when he is reaching for a glass of water or a TV remote.
Yeah, these symptoms are definitely describing ataxia and other complications from the accident.
My former colleagues, Ionides et al., have found that damage from the rupture of the superior cerebellar artery can cause individuals to experience ataxia and dysarthria, among many other side effects.
It is common that patients will have dizziness after this kind of injury, and it seems as though this patient definitely is.
With this information in mind, how can we best provide care for the patient?
All right, I did write some things down here. I can assess the patient's gait, balance, and muscular strength through various tests, such as the Get Up and Go test or the 2-minute walking test. Prior studies compiled and a review by Matsugi have used these tests and compared them following treatment using the International Cooperative Ataxia Rating Scale, aka the ICARS. Some physical therapy interventions that demonstrate the greatest outcome measures in those with cerebellar ataxia emphasize training focus on coordination, gait ability, balance, and muscular strength.
What a great idea, Doctor. I'll let you get to work with the patient. Doctor?
Doctor?
How are you doing today, Mr. Johnson?
Great.
Well, that's great. I just got done talking a little earlier with Dr. Pudeman, and we came up with the best plan to get you up and running again. Are you ready to start physical therapy?
Yeah, let's get started.
All right, I'm gonna help you get up here first. Awesome.